Hi, everybody. This is Carol from STS. This is the Adult Cardiac User Group call for March 17th. We are going to get started here. Happy St. Patrick's Day. Thank you for joining. Our agenda for today, just welcome and introductions, STS updates, Iqvia updates, user feedback. Please use the Q&A function or raise your hand if you'd like to chat with us. I think it's enabled. Yep, and we'll get to your questions the way that we receive them. So get started here. Oh, online with us from STS, I have Jane Hahn, Addie Dolan, Leanne Jones, and I think that's everybody from STS today. Donna McDonald's not joining us, and no, she's not off celebrating St. Patrick's Day. She's busy working. And then from IQVIA, we have Melanie Bent, Joe Brower, Rhonda Murphy, Anna Van Eaton, Jean, and Steve. So thank you everybody for joining. Just a couple updates for the adult cardiac database. The ones that updates that are specific, timeline that are specific to ACS or STS are in the dark or green. Today's our user group call. The monthly webinar is on April 7th. Harvest 2 closes on May 28th with an opt-out on June 2nd. Public reporting is expected to be refreshed using Harvest 1 2020 data in the spring, and we'll be providing you more information on that as we nail down the time frame. The two in the light green are related to TVT. The public reporting consent period's opened for TVT public reporting, which is brand new. The consenting period for that ends on April 30th. We were planning to have a webinar last week, but that got canceled. We are going to reschedule that TVT public reporting webinar, and I'll be sure to make sure everybody's notified when we do. Quick STS updates. The March training manual is posted. Harvest 4 and Harvest 1 are both at DCRI. Harvest 4 should be near completion of the QC for analysis. And Harvest 1, just waiting to hear if it's entered into analysis yet or not. At DCRI, it should be going, if not, very soon. And we talked about public reporting and I think the consenting deadline. I think this was accidentally left over and I think it's already closed. So apologize for that. And now I'm going to hand it over to Joe Brower with the IQVIA updates.
All right, great. Thank you very much. Good afternoon, everyone. Happy St. Patrick's Day. Just one page of updates for today. A few items that were released over the past weekend on March 13th, starting with the MIPS Performance Measure Report and Preview Submission Report, STS 6127. The tobacco use measures for MIPS will now correctly make an exception for patients where the expired in OR variable is answered yes. So that should be in effect currently. For the risk-adjusted dashboard and benchmark report, STS 6064, data for the new onset AFib and cardiac rehab referral were not correctly being displayed in the dashboard, and so that should now be resolved. On the participant non-analyzed dashboard, the STS 6158, the new MT-OPTI plus died in hospital line on that report was incorrectly displaying results over 100%, and so that should now be fixed. And then finally, on the case form, SCS 6095, the temp yes/no 1 variable, sequence number is 7215. That should now appear correctly on all forms going from July 1st, 2020 and onward. And that's everything for me for today. I think we turn things over to Melanie for the next portion.
Thank you, Joe. Hello, everyone. So let's talk about the MIPS 2020 updates. And we do have a couple of items that we wanted to walk through. The first item is STS 6198. And this is specific to the MIPS Preview Submission Report for specific surgeons. This is not impacting all enrolled surgeons. These identified surgeons will see a response on the report that will say no cases qualified for reporting. And that is an item that we are fixing and targeting to have in place by tonight. So we will update the notification section once that is posted. but we are turning that around so that we're able to make sure that those cases are loading for those surgeons. And we've already identified all of those surgeons, and we'll be monitoring that and reaching out to them to let them know that it is resolved. The other thing that we wanted to raise is that during this time, of course, we're coming up to the deadline for the approval of the PSR report. So please be patient when contacting STS related to MIPS. They are currently responding to the requests as they come in the order that they've been received. So they are working through those requests, and we'll be getting back to users on those responses as soon as possible. Okay, next slide. Okay, so with this release, and here, okay, with this release, we, of
The
course,
leprechauns got me,
the
Melanie.
leprechauns are causing
Sorry.
havoc.
Yes, sorry.
Christmas time, we have, what is that, Elf on the Shelf? This
Elf on
time
the-
we have
the leprechauns.
Snoopy.
Yeah.
Snoopy's our leprechaun. So everyone at this point is aware that the preview submission report is available. So this is just a quick overview to say that it's available, and there is a updated, well, there will be an updated version of the report overview. There are a couple of some tweaks that I want to point out. I'm going to bring that up on screen and we can go through that together regarding the steps that are required to make sure that you're able to approve those reports. So we'll go through that shortly. And then I also will go into the platform and we will take a look at certain sections of the report and just make sure that everyone is aware of how the information is populated on the report. We are getting questions related to that, so we want to make sure that we address those. Okay, let's go to the next slide. Okay, so this is just a recap in regards to what's required, because we've already gotten a couple of questions related to this. Of course, the enrollment consent is required. So this is already an item that was available and was closed. The form was actually locked in December. So for those that are participating, those forms should already be available and already listed with, of course, the NPI and the TIN. So at this point, if you were to go into that form, we can go to the next slide. You can see that the form is going to display as locked. And so if you realize that there is a discrepancy, because we've gotten those questions related to the TIN, because again, for CMS, we need the actual NPI and TIN, and we have to make sure that it's the TIN that you're billing Medicare with. Okay, so I think that there was some confusion there. I think some questions came over in regards to the TINs, but so long as we have that combination of NPI and TIN, and that is the actual IDs or that have been populated on the case forms, the system will pick up the NPI and TIN and it will pull in all of those results onto the PSR report. Okay, so this is where it actually knows where to pull that information. So if we have a combination that is incorrect, then we will need to make sure that you reach out to the support team to assist you with that. But as of now, this form is locked and you are not able to make those changes. Okay, so let's go ahead and go to the next slide. And the way that you would navigate, of course, to the PSR report, if you haven't checked as yet, is to select the MIPS participation menu. And then you will see that there's a link that is labeled MIPS 2020 Preview Submission Report. So I think that's the last slide before I actually will take over. Carol, is that right? I think let's just double check. I think this is the last. Yep. So let's go ahead. I'll share my screen. We'll go through and take a look at the report. So let me just do a share. Okay, Carol, if you could just confirm with me.
I can confirm.
All right, confirmed, we're good. Okay, so this is the document that is already posted. It's in a PDF format already posted in the library. So you do have this for reference, but I do want to just do a walkthrough with these screenshots in particular. The site that I'm using at the moment, it does have real information. So there's going to be certain sections that I am not going to display since we're sharing screens. So just the general walkthrough. Of course, if you need further information on the measures, you're able to navigate to the STS website, and the specifications, of course, listed there. So we do have that hyperlink available. We just walk through the enrollment and consent, and this again is where it will pull the NPI and TIN in order for us to be able to aggregate all of the data, because this is another question that comes up. What if I participate at more than one site? Will I have to log into each individual site to approve the report? And the answer is no. So long as you have one consent on file for, and this is specifically tied to this report, the preview submission report, so long as you have that consent, the system will aggregate across all of the sites that the surgeon has information available with the NPI and TIN combination. And so when you go to the report, you will have the option to do the drop down. And based on that combination that's selected, once you generate the report, it will pull in all of the identified records into the single report for that NPI and TIN. And at that point, you're able to see the results based on that. And it may be different. The results in this instance may be different than what you're seeing on the other MIPS report, which is the MIPS Performance Measures Report. That specific report is site specific. It does not aggregate all of the information across all sites. It is specific to the site that you're logged into. So just wanted to make sure that you understand that there is a difference between the aggregated level and the site-specific level report. Okay, so once we've already talked about that the form is locked, once you go into navigate to the actual report, you would select the hyperlink for preview submission, and you would receive an actual drop-down. For surgeons, they will only see their NPI and TIN combinations. For data managers, if you're approving on behalf of the surgeon, they will have the ability to see all of the enrolled surgeons for that actual, that has been associated with that site. They will see the drop down for the combination for NPI and TIN and can generate the report for those surgeons. And so once the report generates, there will be different sections within the report. The very first section is going to, of course, confirm the surgeon that you are reviewing. So it will display the name, the NPI, the TIN, phone number, email, and preferred email. And so this information, again, pulls from the enrollment form, except for where you see the preferred email. I believe the preferred email does pull from the user account. So whatever email is associated with the user account, you may see a difference between what was entered on the consent form and what's actually set up with the user's account. Okay, so just wanted to also call that out. You do have a way to navigate to the consent form if you needed to quickly review that. The hyperlink will navigate you back to the consent form so you can take a look at what was entered in on the enrollment. The next section of the report is going to display all of the associated cases for the NPI and TIN combination. And that, again, you can see within the column for participant ID, you will see a potentially, if the surgeon participates across multiple, you will see a mix of actual cases that are associated with different participant IDs. So again, that is expected. Okay, So for this section, I just want to make sure that I call this out because it is causing a little bit of confusion, and we do apologize. We want to make sure that this is clear in regards to the intent of what will happen, especially based on there is a comment that is listed here. And let me just make this full screen so you're able to, everybody can see this a little bit better. So you'll see in the section for the MIPS quality component section, you'll have the information that is listed where it says an asterisk, data is not included in CMS, in submission to CMS. There is multiple sections you'll see where it has an asterisk. Here in this column, for each respective columns, you'll see that there is an asterisk here, and then down below, you'll see that these also have asterisks. What this statement is related to is specific to these counts. So no information in regards to these counts are submitted to CMS. So they will not receive in the request that we send to them, they're not going to receive a total number of measures reported, total number of high priority measures reported, or the total case volume reported. They actually would not get these numbers. So that's what this statement is in relationship to. But you'll also see that there is an asterisk after the measure name. So that's where the confusion is coming in. So this asterisk actually indicates that the measure that's listed here is an inverse measure. And so, of course, the information that's related to this individual measure, that will be submitted to CMS. So the information that you see listed here in regards to the performance met, performance not met, the performance rate, that information will be submitted to CMS. So I just wanted to make sure that I called that out, and we do apologize again in regards to the confusion that that may have caused. But just know that the asterisk that's after the measure name indicates that the measure is an inverse measure. So what we expect, of course, with those measures is that the lower the number in regards to performance met is actually good. I'm sorry, the higher the number for performance not met is what we would want, okay? And if the performance met number is either 0, or in this instance, we have 3, the lower the number is actually what's expected. So that's showing better care. So that, I just wanted to make sure that I called that out. Okay, so let's also take a look at, this just goes through the definitions of each of the columns. So I will skip over that. Again, this is available for you so you can review, and I will, of course, bring us into the report just so you can see just a quick review of that report. Let me just go through. This again is the layout and the definitions that are available for that section. And here is where I wanted to make sure that everyone was on the same page on how we are submitting and approving these reports. So when you initially go into the report, you will have an option that will be available, which is the Save Submission button. So that will be the initial step. And so you'll notice that here you'll have a submission progress bar, and here it basically will be at the first step, which is started. And then you'll have the initial message that basically lets you know that the submission data has not been saved. And the deadline for approving your submission is before March 20th. So March 19th, 11:59 is the actual deadline. And so what will happen after that deadline is that the form will be locked. And so when you access the report, the buttons will actually be disabled after that deadline. So once you've saved the submission, you will then have the next available option, which is Approve Submission. And then you'll also see that the progress bar increments and it moves to a saved status when you initially saved it. And so the next step would be to approve. And so once the message the report is approved, let's go to the next. It will then prompt you with this message that basically indicates that you would need to approve the data submission, and basically by clicking this checkbox where it says I approve and then hitting save and close, that message will then move the report into an approved status. Once it's in that status, so here is where you would then select that, and you'll see that approve is in progress. So I was just walking you through the different steps. Once the actual report has been approved, you will get a message that it says approved successfully, and then the button will change to unapproved submission. So once it's sitting in this status of unapproved, it will allow you, before the deadline, it'll allow you to go back and unapprove and then reapprove the actual report. So if by chance, again, you realize that there was an item that needed to be updated for some reason within a case, maybe you reviewed that further and you needed to resave that, that change would then have to be included into the results that are associated with this report. And in that instance, you are able to unapprove and then approve the report again. And that will allow you to basically get those updates. And so you'll see that the submission bar is showing that now it's approved. Okay. If by any chance you're encountering an issue with any one of these steps, please reach out to our support team so that we are able to assist you with making sure that you're able to do this submission and approve. If the surgeon decides that they do not want to submit the actual results, the system will not pick up reports that are not in a approved status. So if they leave it and they do not save the submission, they do not approve the submission, that state will basically be bypassed. The only way that the report will be picked up to be sent to CMS is if the report is in an approved state. So we've had a couple of questions related to that to say, well, I don't want to submit. I'm not going to send in my results. What do I need to do? Well, at that point, you would just leave the report in an unsaved and not approved state. And that basically will bypass that report from being submitted to CMS. Okay. So here I would just walk through in regards to unapproved. And it does give you every step of the way. It does give you the statuses as you're going through that process to let you know where you are. And then once you unapprove, it will let you know that you've unapproved successfully, and it reverts back to the initial step, which is save the submission, approve the submission, and then again, if it's before the deadline, unapprove would be the last step. So it would just basically go through the same steps again. Okay. Once the report is locked and the report has been picked up by the job that runs in the background and it has been submitted, once you come back to the report, this actual step where you see submitted would be enabled. Right now, you see that it is showing up disabled. It's grayed. Once the job picks up the actual approval, that step would be updated, and you would see that the submitted option would be highlighted. Okay, so it would also show in a color. Okay, a couple of things that I wanted to make sure, of course, you have available, the different definitions that are available. Please know that there are two measures that have an additional calculation related to risk adjustment. So 445 and STS1, there is an additional calculation that is available, and I will update the slide to include those two calculations. But there is, you have the general calculation of what's available for the rest of the measures, there is an additional calculation for 445 and STS1, which uses the rate and multiplier values that is provided by DCRI. And I believe that table is posted on the library, and that's for Harvest 3. Okay, so I will have this updated, and later on today you can check and you will have that information. Let me just see what else quickly. This is just talking about the measures. We had a couple of FAQs. I did do an update so that we can make sure that it's called out specifically, where it talks about the approval deadline. It is March 19th at 11:59, so it's before March 20th. So the specific deadline is March 19th, 11:59 p.m. EST. Questions that we've received in regards to multiple TINs. Do I have to approve each NPI and TIN combination? Yes, you do have to approve those combinations. Let's see, we've had a question where we had a surgeon that wanted to know if it was available to see others' results. No, they will only be able to review their results for the MIPS report. And another question that came up is, how are the report results generated? And again, the report logic looks across the entire database, and it looks for the combination of the NPI and TIN. This information is not generated at a participant level, meaning that it's not going to go in submitted by just that single participant. It is looking at the combination of NPI and TIN. And I think I've stressed that a couple of times. And let's see what else we have here. Questions related to access to the report. We've had requests from data managers who are going to approve on the behalf of their surgeon and wanted to know how do they get access. And you would contact the STS DB at sts.org to request the access to review the report on behalf of the surgeon. Please CC the surgeons under that participant ID who have consented, so that we make sure that they are aware of this request. And then reporting period, that we just threw this in here. It's, of course, the 2020 year, January 1st through December 31st. And you must collect the data for that 12-month performance period. And let's see what else is there. And then in regards to the CMS deadline, because there's two different deadlines. There's the deadline that we have to approve the report within the application. So we've already discussed that as March 19th. And then CMS has a deadline to submit to their portal, and that's March 31st, 2021. And I believe their cutoff time is 8 p.m. Eastern time. Okay, and I can just add that note in here too. But just wanted to throw these out, and let's just quickly, I think I've already gone through a lot of the slides, but just so you're familiar, for those that may have not taken a look as yet, when you log into the platform, my login is a little bit different in regards to my permissions. So you may see more than what you currently see, but the main thing of what you're looking for once you log in is the MIPS participation link. You would select that, and that will navigate you to the, let me just bring you there so you can see. That will navigate you to where it shows MIPS 2020 participation. So you would see your enrollment forms, and then you would see the MIPS Preview Submission Report. Once you select that, you will then have the NPI and TIN dropdown. Okay, and that's what you would select. And basically, once you select the combination, you would select Submit. Once you select Submit, it will load I have information in here that I am not able to share with everyone. So I navigated specifically where you, of course, will be able to review the measure results. And so again, with this report, since it spans across all of the different sites, if a surgeon has more than one site, you will see those aggregated results within the results of these measures. Okay, so that's what you would have. And again, just want to call out any of the measures that have an asterisk, that is an inverse measure, and those results will be submitted to CMS. Okay. All right, so I think that's where I will stop. I'm sure we have questions that we probably need to get to. So I will stop sharing. Okay, and Carol, back to you.
Sorry about that. There we go. Thank you, Melanie. Lots of questions coming in. Here's the Iqvia support plan, STS tech support at iqvia.com or the phone number. And the ACSD regional groups, I wanted to put a plug out there. First, I wanted to apologize to our Illinois group, who is led by Cindy and Gary. I accidentally left their name off of this list on our last user group call, so I apologize. They've been involved with the database for a very long time, leading the regional group in Illinois. They have decided that they're both stepping down, so we're looking for replacements in Illinois to take that role on. And I would really, I hope that somebody on this webinar is willing to do that, or if you'd like more information, please reach out to me or Emily Conrad, and we can put you in touch with Melissa Clark, who is leading the regional groups. So thank you to Cindy and Gary for your years of dedication to the database and for taking lead on the regional groups. And we're sorry that you'll no longer be able to help us out with that. And then STS National Webinar Database webpage, STS Tech Support at iqvia.com, and then the database feedback form if you'd like to provide some feedback. Please use the Q&A function. We're going to go to questions and encourage your feedback, and we want to hear from you. The next webinar will be April 7th. It's the monthly webinar. So please be sure to join that. We'll have some education. I think we're going to talk about just a high-level overview about star ratings and risk adjustments, looking at the internal mammary usage, and lots of questions from sites about why they're 100%, but 100% usage, but not getting 3 stars. So we'll kind of talk a little bit about that on the upcoming webinar. I am going to go to questions now, Melanie and Jane, if you're ready. We're going to go ahead. So the first question is from Sarah. We've answered a few questions in the Q&A, so you could check those out under the answered tab. The next question we have is from Sarah. Have the letters gone out to inform the hospital? Have the letters gone out to inform the hospitals that they are to have a 2020 chart audit? We have not. The sites have been picked, but we have not sent notification out. It will be coming soon. Adult cardiac is being managed by a new company this year called HMS I think it's Healthcare Management Systems, and they will be reaching out to you with audit instructions if your site has been chosen to be audited. Iqvia, you could take this one. Does Iqvia build their Dqrs based on the specs for version 4.2?
Yes, we do. Is there a specific question in regards to the spec? But yeah, we build according to 4.2 and 2.9 and 2.81. Nothing prior to that.
Thank you. My team is inquiring whether we should use our vendor's DQR or Iqvia's DQR. I think they're both very helpful, so you should probably use both of those to ensure your data is clean. I recommend using your vendor DQR before submitting your data to Iqvia, and then using the Iqvia data quality reports, the participant dashboard, missing variable report, and data upload to check your submissions after you've already cleaned them through the vendor's DQR. And this one I'm not sure about. This is from Heidi. It says, does the NPI change if the hospital changes their name? I don't think it does.
Doesn't that also depend on contracting? And I'm far from the expert on this.
Yeah, I'm not
only
sure.
remember
about-
conversations.
I think it depends.
Yeah,
It doesn't always happen that way, but you need to check with your hospital administration.
Yeah.
Thanks, Leanne. Does the length of stay affect the star rating, and how is it calculated? Length of stay does not affect the star rating, and it's calculated from OR discharge date to, well, I think we report out two total. We may report out total length of stay and then post-procedural length of stay, or at least we used to, and I believe now we may only be reporting out post-procedural, and that's what's reported out in the outcomes benchmark report, and that's calculated from OR discharge date to hospital to acute care hospital discharge. If I've updated data and resubmitted it to Iqvia after the surgeon has approved their MIPS, do they need to unapprove and redo submit approval of the report?
I can take this. So yes, if there was an update to the data and it was resubmitted, the PSR was already approved, the surgeon or the data manager who has access to approve on their behalf would need to unapprove the actual report to pick up the changes. Because once it's approved, it puts it in a locked state. And so data changes are not going to update unless you take that step.
Thank you, Melanie. Is there any way to download the preview submission report? When I try to print, I only get a small portion of the quality measures reported. I'd like a printed copy so I have evidence for my surgeon.
So it's not a printable report. If there is evidence that's needed, the surgeon can access it. It's electronic. The surgeon would be able to log in and also see the submission status and the approved status that's listed on the report.
Thank you. This is a short timeline. Can't they have until at least Monday? We've had this open for a while now, haven't we?
Mm-hmm. Now, if they're one of the surgeons that I had referred to earlier where they're encountering an issue, and again, we've identified those surgeons, then we will be working with those particular surgeons to make sure that they are able to get in their approval. But the report has been open now. I think it's been 2 weeks.
And Melanie, wasn't there also the MIPS performance measure report available since last November?
Yes, that also had been available since last November.
Right.
Thank you.
Thank you.
And here's one that I think we get frequently regarding the three.
Mm-hmm.
Hold on 1 second.
Tobacco?
Three tobacco.
Yeah.
Please explain the calculation for the 3 different tobacco cessation measures.
Yeah, so actually, I think this is, let me just bring up my screen and let me bring up the STS website also.
Do you want me to stop sharing, Melanie?
Yeah, and I will
Okay.
share my screen. Let me just bring up. Here we go. Sorry, I was trying to get to the merit. All right, there we go. Let's do a share. Okay.
You can see your screen.
All right, perfect. And I am opening here the tobacco screening document. Okay, and let me make this a little bit bigger. Hopefully that helped.
Yes, ma'am.
All right, so so this is the tobacco measure, which is 226, but you'll see that it's broken into 3 different performance rates. So this is what CMS references as a stratified measure. And so for each one of these measures, the criteria is being reviewed. So criteria 1, which I believe on the report, it's listed as 226A, or it may have an _1, but basically it falls in line with the specifications that you see here. And so the first one is basically stating percentage of patients who are 18 or older who were screened for tobacco use 1 or more times within the 24 months. So each one of these, it's looking at the criteria that's listed here. So basically it was the patient screened for tobacco at least 1 time. The next one is the patient 18 or older who were identified as a tobacco user, and they also received tobacco cessation intervention. And then the last item is percentage of patients 18 or older who were screened for tobacco use at least 1 or more times within 24 months and who received tobacco cessation intervention if identified as a tobacco user. So these 3 are the criteria for that measure. So hopefully that helped in regards to what is currently being reviewed. Okay, and I can stop sharing here.
Okay,
Back to you.
thank you. There it is. Just have to find where it goes when I do that. I think it goes onto like a hidden screen somewhere. Okay, thanks, Melanie. I just tried to run our MIPS report, and when I click on a surgeon, it says to check the participation. Does this mean the surgeon has not yet approved? Anybody?
Sorry, I went on mute.
That's okay.
It says that to check the participation. So it could mean 2 things. The other thing that you would like to, you probably need to check is the actual enrollment. So if you see that there is an enrollment form for that surgeon, then the only other thing that we would need to check is to make sure that you have access, that you are granted access to review the report. Okay, so there's 2 things. Check for the enrollment to make sure that the surgeon is actually enrolled. And then if you see that they are enrolled, but you're still seeing that message, the access to the report has to be granted by the STS.
To the data manager.
To the data manager. Correct.
Did you already show where they verify if the surgeon's active or not?
Yes. So, and I can bring that back up.
Okay, yeah, that would be great.
I can bring that back up. One
Okay.
moment.
This is Jane. Amy, if you wanted to email stsdb@sts.org, we can also look up your surgeons individually if that would be helpful. Sorry to jump in, Mel.
No, it's okay. All right. So here is where if you navigate to the MIPS participation link and select the MIPS 2020 participation, that is where you will see the list of all of the surgeons that are participating in the MIPS program. If you see that there is no consent form, then that means that the surgeon did not submit a consent form. And at this point, it's already past the deadline.
Thank you.
Mm-hmm.
For the sites that are having issues with MIPS, will they have an extension after the 19th? I know one of my team members is in contact with STS to help resolve our issues.
Yes, we will be working with those sites that are impacted. Again, this issue will be resolved by tomorrow. So we will be communicating that the surgeons should be able to access, or those data managers that are accessing on behalf of, will be able to go in and review those results.
Great, thank you. This is a non-MIPS question. Can you clarify how to answer the 2 temp fields Impella device used in the MV mitral valve model 5300, the PhysioFlex annuloplasty ring, if no Impella support was used or not an MV case using this device? Do we uncheck the field to answer no, or are we leaving blank unanswered? You can leave those blank for the Impella device used if you did not have any Impella support. You can just leave it blank. It'll show up on your missing variable report, but that's because it's a temporary field and we don't have any parent-child logic built into the temporary fields. So just leave that blank. if no Impella device was used at all. If an Impella device was used and it was the less than 5.0 liter flow, then check no. If it was not, didn't meet the criteria, to check yes. And the same for the PhysioFlex annuloplasty ring. For non-mitral valve cases, just leave it to blank. If there was a mitral valve implant and it was not the PhysioFlex annuloplasty ring, then you will check no. And if you have any questions, feel free to reach out to me or Melinda. Is the MIPS 2020 participation form to be created, submitted by the abstractor or the surgeon?
It was either the surgeon or the abstractor that had the ability to go in and add that consent form. But right now, it's already past the deadline with getting a consent added. That deadline was back in December. I believe that was December the 2nd. It was locked.
Okay. Very good. Thank you. Next question is, and I saw another question, kind of the same thing. Is there any way that we can get this video uploaded to the STS YouTube channel quickly as possible? I'll work with marketing, but usually it's a day or two before they can render the video and get it up, get it in the format for YouTube. So I don't think that will be helpful to you. But then it says, or, you know, you'd like a faster way to get a copy sooner so you could walk it through with the surgeons. And if you'd like to email me, I can send you out the raw link to the video. I usually have it within a couple hours and I can forward it over to you. It just won't be in a very nice format. So you'll have to open it on Zoom and things like that. But feel free to reach out to me if you do want this video sooner so you can review it with your surgeons. I'd be happy to share that with you. What if we were told there was a TIN mismatch, but Iqvia and STS can't tell us the cases and we can't see it in our database? Will this show on the MIPS report and then we contact the support team?
What if we were told there were 10 mismatches? Can't see, will this show? So if the 10 is available, and I don't understand the 10 mismatch, so we may need to come back to that. If the 10 is available and it's associated with that MPI on the case form, it's going to pull that information into the report. So you will see all of those associated 10s with that MPI.
I think, Melanie, by mismatch, they may mean if the 10 on the consent form doesn't match exactly what's provided in the data file.
Okay.
Or there's like a typo or something.
And if that is the case, you are notified on the MIPS performance measures report. So the initial report that was made available, all associated TINs are displayed in regards to however, whatever TINs are entered in on the cases, those TINs are pulled onto that report and they show in the header. So I think that's the fastest way that you would be able to determine whether or not the TINs that are entered in are mismatches. I think that would be the fastest way. Hopefully that helps, Karen.
Thank you. And then Gary's asking, will these slides be available for review and where? And the slides from the STS presentation will be posted on the STS website under the webinar section for the databases. But Melanie, what about your slides that you showed? Are you able to share those?
Yes, it's actually already posted. There were just a couple of tweaks that I wanted to update. So that same presentation that I just went through is already posted to the library in the platform.
Oh,
I
sure.
just needed to just do tweaks to the date to make sure that it's clear that the deadline is March 19th for the approval at 11:59. Like that's what I updated.
Okay, so let me
so
share
I
my
will post
screen real
that.
quick here. So this is is it under the library here?
Yes, under the
MIPS?
library, and it's the MIPS 2020 MIPS Preview Submission Report Overview.
This guy.
Yes.
Okay, so it's there already posted. Thank you.
Mhm.
And then for the STS pages, for the STS page webinars, they're posted under the STS National Database. And then if you just scroll down under View Webinars. And let's see if it's going to go. Here's today's webinar, and then April 7th, and then the past ACSD webinars are posted here in reverse chronological order. And we have our own YouTube page. So if you wanted to go to the playlist for all the webinars back from October 2018, you could do that here. Okay, thank you. Just to verify, if we choose to opt out of public reporting for TVT, I need to notify STS. No, TVT public reporting is run through the TVT registry through the NCDR ACC platform. So if you go to, and it is not connected to the STS adult cardiac public reporting in any way. It's a separate consent form, separate process to get enrolled, and separate reporting measures. You can find more of it here if you go to registries, ACC TVT registry, and visit the TVT registry website. On the left-hand side, you'll see a link to the public reporting information for the TVT registry. The companion guide is here. This explains what's in the measure, what's going to be publicly reported, and then there's the data release consent form, which is an addendum onto your agreement that you already have with STS and ACC for the TVT. If the MIPS is for the full year of 2020, but Q4 is not yet back after analysis, how does that get to CMS?
The MIPS data that we run is against the data that's in the database. So your Q4 information is already available in the Iqvia platform.
Right, it's not based on the analysis that's done at
No,
DCRI.
it's not. Correct.
Thank you. Did she just say the MIPS numbers we see are for surgeon's performance at all sites that report for him?
That's correct. In the preview submission report, it displays the aggregated case results for all sites that the surgeon is participating at or has data that's being collected for them. Again, it's looking at the MPI and TIN across the entire database. So if that surgeon is participating at 5 different participant sites, it's looking at the entire database and aggregating those results into the report.
Great, thank you. I'm being told by Donna McDonald that if the MD is having MIPS reported at a corporate level, having the same TIN, they should not approve their MIPS with STS because it can subvert other measures submitted. This has been the rule, the same rule that's been in the past. And then CMS takes the first measure received. They do not consider all measures submitted. I know we talked about that earlier. I don't know if Jane or Melanie, you wanted to add on to that, but Donna's telling you correctly.
Yeah,
Agreed.
I don't have anything else. Yeah,
That's correct, Kathy. Okay, thank you. Beth's saying she went to look at the MIPS report that was in the operational reports today, and 2 of the 3 surgeons are now missing. Did something happen?
no, nothing should have happened, Beth. So you're saying you go to operational reports and you're pulling up that MIPS report, which is the MIPS performance measures report, and you don't see their names in the drop down? Like that's the only that should
She's
not have
raising her
changed.
hand. Hold on,
Yeah,
let's see.
let's talk to Beth.
Let's talk to Beth. Okay, hold on. Okay, Beth, you just have to unmute yourself. Oh. I accidentally muted you again.
Uh-oh. Double mute.
Can you hear me
Are
now?
you there? Are you there now?
Yes.
Sorry.
So I went in just to look at that operational report this morning.
Mm-hmm.
And yeah, yesterday all of them were there.
Mm-hmm.
And today I only have one of the 3.
No, nothing had changed. So we will have to take a look at
Okay.
you have 2 is it 2 sites that you have or just one site? Can't
Just
remember.
one, just one
Just one
site.
site. Okay. All right.
But
I
if you,
will
yeah,
take
if
a
you
look.
could look at it, because I need to validate the other two, because we had some problems with our MIPS numbers.
Yeah.
And
Yeah.
I've already validated, of course, the one who's there.
Okay. So I will take a look and I can get back in touch with you, Beth. I'm
Thank
going
you.
to pull that up and I will reach back out to you.
Thank you.
You're welcome.
Thanks,
I'll
Beth.
mute
Thanks,
again.
Melanie. Okay.
Bye-bye.
Bye.
Bye.
Thanks. Okay. All right. Let's see. Is the webinar recorded? Yep, it will be recorded. But if you need this information sooner than, if you need this information, it probably won't be posted to the website maybe by Friday. So if you need this sooner, please email me, Erica, and I'll send you the raw recording of it because I'm sure it'll be helpful to you in this. So I put my email in the chat box, if you see it there. How long does the submission process for sending the MIPS files? The deadline is March 19th. Does it take hours to do or a matter of minutes?
Oh, I thought I was on mute. Sorry, I'm here. It actually takes, depending on the volume of how many it has to go through, but it's within minutes. It's real time. Once the job, basically it will activate at a scheduled time period throughout the day, and it will pick up those actual approved reports, and it just automatically transmits that over to CMS. And within minutes, I'm able to see that CMS receives that submission.
Okay. Have there been reports about incorrect metrics in the harvest? This is a non-MIPS question. Has there been reports about incorrect metrics in the harvest report for various hospitals? My hospital had incorrect values, and we have submitted to Iqvia support, but are pending reply. Readmission rates were showing as significantly high for multiple procedure types despite previous harvest reports. And the ticket number is there. Gina? Jean, do you want to check into this one and maybe, I'm not sure exactly which.
I
Sure,
just noted
I'll
the
take a look
ticket.
at this one.
Okay, thank you. We changed our name and my MPI number did not change. I just changed our name in the admin section at the registry. Yep, that's fine, Vicki. Not all MPIs will change if your hospital changes name. I think it depends on if it's a merger or something like that. Is there a way I can click to add the values to the values of the bars in the graph? I think so. In the longitudinal, you can click on the graph and it adds the data points. I'm not sure about the benchmark diagrams. I think if you hover over them, it will show the values, and I'm not sure if the values print or not. Do you know, Melanie? In the benchmarked graphs?
In the benchmark, when you click the values,
Yeah, so
I think it's vice versa. I think if you click the bar that it highlights the section in the report, but honestly, I can't. Let's see.
oh, we're at time. I want to see where would well, that's pulling up. Erica, my email I'll put in the chat box again.
Carol, someone had asked to, Jared had asked where I put the link in the chat box for the STS performance measures out on the STS website. He was asking where that was. So that's also in the
Okay.
chat box now.
Thank you. Oh,
If you click in the graph.
yeah, let me pull up a graph. Hold on. I pulled up.
Yeah, you got it.
Yeah, I pulled up the wrong one. Sorry about that.
And then click outright and then click a value in the grid. And I think it does the same thing.
Okay, wait, what do you want me to do?
Like click a value in the grid and then that'll also highlight a bar. So like, right, just any value there.
I think they're wanting to see the values printed above.
Oh, okay. In the PDF export, labels do print. If there's a lot of data, it does print every other label. So that is how Spotfire works. But you can zoom in, and then if
Let me see what just happened. I just exported this to Excel. Oh, I just exported it the same. Maybe we could do that in another demonstration. Unless, Rhonda, are you there?
yep, we can yes, we'll take this question and bring it back.
Okay, thank you. Somebody's saying they just received their MIPS email on Monday. I'm certain it was a reminder email of something that was sent out long ago, longer time ago. Jane, did you have any info on that?
Sure. We sent an email blast in November to all MIPS consenting surgeons and designees regarding the availability of the performance measure report. Surgeons who had not logged into the platform ever received a communication last week asking them to sign in to activate their MIPS report, and the deadline was provided. I believe in the notification section, Iqvia posted a notification regarding the availability of the MIPS Preview Submission Report, and then what was sent on Monday was a reminder, as Carol stated.
Thank you. Okay. Was not super clear that submission would take place unless surgeon signed on and approved, only that it was required in order to visualize a MIPS report. Surgeons have always had to sign their and approve their MIPS report. I'm not sure I understand the question, Kathy, sorry. I'm not sure, Michelle, I'm not sure of the hospital deadline for MIPS.
Just in general, I'll just throw this out there. Just the CMS deadline is March 31st. So that's the deadline for any submission.
Okay. Thank you. And Kathy, you may want to, Kathy, I see your comment about what was in the consent form for MIPS. You may want to reach out to Donna McDonald with that question regarding the consenting language. I could see where there's confusion about if the hospital is reporting on behalf of the surgeon. So reach out to Donna McDonald with that and ask her for clarity on it. I'll put her email in the chat box.
I'll do it. I'll get it, Carol, if you want to. Oh, look at you. You're fast.
Yeah, I'm quick.
You're freaky fast.
So the question regarding COVID cases, COVID's excluded from the mortality. It is not excluded from the MIPS measures reporting. That's correct. The tobacco use can be yes for sensation, but not for alcohol. So that measure is not met. This is where I am confused. So the patients who do not, Iqvia is adding the exclusion criteria in for patients who are no to smoking to exclude those patients. So they wouldn't, if you do answer the NQF, I think it's 2597 as a negative, as the patient did not receive the appropriate counseling and screening and counseling, but you had already excluded that patient by marking that they were not a smoker, that patient will be excluded. I came in late, so I'm sorry if you already entered this question. Can you create a document with the MIPS requirements? Is the MIPS approval that is due on Friday for 2020 or 2021? It's for 2020. And I'm not sure I understand a document with the MIPS requirements. Do you
The
understand?
measure specifications are available on the STS website. Is that what they're referring to potentially?
I'm sure it's, well, I don't know, but here's quality, safety, performance measures, and then you'll see the MIPS, merit-based incentive payment system here, and it'll run you through the measures that are used for MIPS reporting. I understand it is being said that the results have been available for 1 week. They've been available, I think, for more than 1 week. I think it is helpful to understand our workflow for many abstractors. I submit for 5 different registries, and I'm not in this very complicated and detailed platform every week. It would be helpful if there was a time-limited deadline like the one we were just notified of, requiring this to be done in the next 48 hours. An email would have provided most helpful. So I think Jane mentioned that multiple emails were sent and notifications posted in the Iqvia platform. Michelle, if there's something else we can help you with, just let us know. My facility is 100% compliant with smoking education, but for the assessment and counseling of ETOH has been missed. So that is part of the STS data form for 4.2 includes smoking, ETOH drugs. Am I missing something here? Pat, you could email Donna with your question on that, on the NQF measure. For the temp field, physio flex annuloplasty ring, while it is not given a parent-child relationships in the specifications, would it be all right if a vendor applies a parent-child relationship parented by mitral implant to simplify the process for users? The specs are not to be changed, so we shouldn't do that. We shouldn't be adding things into the specs that hasn't been sent out to all the vendors. It would be nice if we could have added a parent relationship in, but that's not how the temporary fields are built. So if for some reason we stop capturing that and we go to capturing something else in temp Y N2, we would have to have you redo all that programming, and we don't want to do that. So we're not going to add a parent-child relationship in there, but it's a good idea. Okay, there's quite a few more questions in here. I think we're already about 8 minutes over. If you have a specific MIPS question, you could reach out to Donna McDonald with that. When it was covered previously that MIPS with STS could interfere with other MIPS mission, my information was that it would not interfere. So Kathy, like I said, please reach out to Donna with that question. The MIPS approval email was just sent on March 15th. So I think Jane said that we had sent out actually an email prior to that to surgeons that had not signed in at that time. And the original notification was sent out in November. What should I do if one of my surgeons have left the organization with no ability to contact for MIPS approval? Any suggestions on that?
So they consented to participate. I'm assuming that there's a consent on file. And if there's a consent on file, then what other locations are doing is that the data manager is submitting on their behalf. But if you need to contact that surgeon to confirm, if you leave the report in an unapproved state, the submission will not be sent to CMS. So I think there probably would need some clarification with that surgeon, I would think.
Thank you. If my surgeon participates at 5 different hospitals, does he have to approve his MIPS at each hospital or just one-time login? It sounds like it's all combined, correct?
It's all combined, one login. So long as they're approving, if they have multiple TINs, so long as they're approving the NPI and TIN combination, all of the results for all of those sites will be combined in the single report.
Mm-hmm. Thank you.
Mm-hmm.
Okay, I think we're gonna end there. If there's, hold on one second. Sorry, I was unclear in my question about a document for MIPS. There are timeline requirements and unapproval with subsequent reapproval situations that I was unaware of. I'm wondering if there are other things I don't know. Is the consent requirement only that they signed on after I've submitted everything by proxy, or do they have to click a box that says they consented? The consenting period ended, I think it was back in December, Jane and
Correct.
Melanie.
That's
And
correct.
so now what
Yes.
happens is they need to go and they need to approve the submission. They've already consented, so now they need to approve that submission. I hope that helps, Deborah. If not, please reach out to us and we can answer your questions a little bit more clearly. Okay. No. So Deborah, please reach out to us and we can help you with your additional questions. Okay, thank you very much, Melanie, Jane, and STS and Iqvia, and thank you everybody for joining today. I hope you have a good rest of the day, and we will talk again soon. Thanks, Melanie and Jane, for all your help.
Thanks, Carol.
Thank you.
Thank you.